today and started your day with a nice hot cup of coffee. If you're anything like me, the sound of the coffee pot brewing and the sweet aroma of the coffee beans excites you and already makes you feel more awake. Or if coffee isn't exactly your cup of tea, how many of you woke up this morning drinking a hot cup of tea? Either way, caffeine has become mankind's preferred way of waking up in the morning, or in some cases, an alternate to sleep. Caffeine is better than most drugs because it is a harmless psychostimulant. Today, I'm going to address some of the stigma against caffeine consumption, and in turn show some of the benefits it has to our body. I believe that caffeine is good for you when consumed in moderation because of its benefits in terms of cognitive function and physiology. First, let's talk about how it affects cognitive function. Cognitive function is defined as perceiving ideas, thinking, and reasoning. Caffeine inhibits the binding of adenosine and benzodiazepine to their receptors in the brain. These neurotransmitters slow down brain activity. If they are inhibited, the body begins to feel this hyperactive effect that we get when we drink caffeine. A study done by Smith and Rogers in 2000 found that caffeine improved cognitive function, and that regular caffeine users were affected more than non-regular caffeine users. The study also found that drinking a higher amount of caffeine in one sitting did not affect cognitive function any more than drinking a lower dosage of it. Caffeine is absorbed from the gastrointestinal tract, and it is in the blood plasma levels peak between 60 and 90 minutes after consumption. So if you're drinking coffee in order to prepare for an exam or an important event that day, you keep this in mind. Now let's talk about some of the reasons against caffeine consumption. Coffee is known to aggravate gastrointestinal reflux disease. So if you suffer from heartburn, stomach pain, or acid reflux, you should probably stay away from it. Many people also believe that drinking coffee results in dehydration. A study done by Berkner in 2008 actually proves this to be true. The study found that caffeine improves blood flow to the kidneys, which prevents the reabsorption of sodium, magnesium, and calcium into the bloodstream. And in return, your body expels more water. However, the study is conducted with people who drank high levels of caffeine in one sitting and were regular caffeine drinkers. So it can be deduced that drinking caffeine in large quantities is what is really dehydrating, not in moderation. Finally, coffee is known to increase blood pressure and have a diuretic effect on people. However, this effect is diminished in people who are regular caffeine drinkers. I believe that the health benefits of caffeine outweigh the disadvantages. First of all, caffeine is the leading source of antioxidants in the typical American diet. Both coffee and tea contain polyphenols, which have a positive effect on the heart. A study done by Ruxton in 2008 found that polyphenols promote positive effects on the heart, which includes relaxation of blood vessels, which leads to less blockage, decreased risk of stroke, and lower blood pressure. Caffeine has also been shown to have a J-shaped correlation in terms of suicide and depression rates. A study done by Lara in 2010 found that people who consumed anywhere from 1 to 3 cups of coffee a day experienced lower rates of depression and suicidal thoughts than people who consumed in upwards of 5 to 8 cups a day. Caffeine has many positive effects, as you have now seen. It improves cognitive function in terms of inhibiting neurotransmitters in the brain, contains polyphenols, contains antioxidants, and it can decrease risk of stroke and cardiovascular disease. However, when consumed in large quantities, caffeine can be dehydrating, can actually increase depression and suicidal thoughts, or worsen gastrointestinal reflux disease. So in conclusion, don't stop drinking coffee or tea. If anything, you should increase your consumption to as much as 4 cups a day or 400 milligrams of caffeine, which is considered moderate. This will help you receive the maximum amount of benefits from it. Caffeine is not a silent killer like many other drugs, so if you're going to be addicted to anything, it might as well be caffeine.